Hello, my name is Selena Egamasi, and I am a student at Bradman University. In this integrated therapy video, I will discuss three main therapies that will be used in a blended and symbiotic manner to help the patient develop insights and solutions to her problems in the context of individual psychotherapy. Having given her consent, I will first provide a brief overview of her case, highlighting the reasons for seeking psychotherapy help. A patient will be enrolled in this proposed treatment after signing an informed consent and accepted to be part of the integrative therapy video after consenting to be recorded. I will then continue with her brief overview. Judy is a 45-year-old Asian American female who was referred for therapy by her family and friends after a difficult breakup and divorce affected her work performance and personal life. Judy's a real estate consultant, financial advisor in one of the major firms here in Florida. The patient was referred to the clinic because of persistent symptoms of anxiety and depression accompanied by sleeplessness. Judy has undergone a divorce, and this has affected her emotionally, physically, and psychologically. The divorce came at a time where she was pursuing her master's degree, which has affected her academic performance. Judy has reported of having daily weeping spells, restlessness, anxiety, fatigue, and low mood. She stated that she experiences headaches and has developed a fear of getting into relationships. She has reported that her sleeping is disturbed because it takes her several hours to fall asleep. Judy has also explained to me that she has developed a lack of concentration, lost in interest in activities. I've even noticed that during the interview, she seemed to get lost for about 4 to 5 minutes at a time. She has been experiencing these symptoms for the last 8 months. Judy blames herself for the failed marriage, and her ex husband always told her that she had no time for him or their son. Judy expected her ex husband to understand the situation because she was working and at the same time furthering her education. She co parents her 15-year-old son with her estranged husband. The divorce has contributed to her depression, restlessness, and anxiety. Judy also confessed to having suicidal ideations. The patient has been prescribed Celexa, which is citalopram. It's a antidepressant. It's prescribed to her to treat both her anxiety and her mood disorder. However, the symptoms reoccur when she is not under medication. Judy is ready to seek for assistance for psychotherapy to help with her condition to live a positive life. I will now integrate behavioral therapy to assist Judy to explore coping strategies to help her overcome suicidal ideations and negative thoughts. According to the Diagnostic and Statistical Manual and Mental Disorder, 5th edition, which is DSM 5, the patient has a major depressive disorder, which is MDD. A patient with MDD experiences excessive anxiety, restlessness, um, anxiety fatigue, and low mood. Judy's condition is also characterized by feeling like a failure, trouble sleeping, and she does not like to interact with people surrounding her. Psychotherapy modalities. The integrative therapies I have identified for use in treating Judy are cognition behavioral therapy, which is CBT, motivational therapy, and mindfulness approach. The three approaches are effective in changing the thought process of the patient. I will combine the three psychotherapy modalities to help Judy improve her self esteem levels, her confidence, motivate her to live her life, and ensure the best outcome for this client. I will first apply CBT, followed by motivational interviewing, and then mindfulness approach. The CBT is a goal-oriented intervention approach that focuses on the problem faced by the client and changing the behavior and cognition. The CBT is appropriate for this case because it will help the client to change her behavior, to develop coping strategies. Also, The CBT will be applied to this client to change her thinking in order to improve her thought process. The CBT will be applied to promote change, to address depression, anxiety, restlessness, and to improve the mood of this patient. The mindfulness approach is purposeful, non-judgmental attention to the issue, and meditative practices are used to learn the process. The rationale of the use of the mindfulness approach is to help the client to present to be present in her current life. The mindfulness approach will be applied to ensure that the patient is more present in her life in order to change the current challenges that she faces. The motivational therapy approach is the deliberate attitude to face life, regardless of the current happenings at the moment. Motivational therapy is applied to help patients to make changes in the behaviors. The motivational therapy applied to guide the patient to feel empowered, to help her engage in a healthy, promoting decisions. I will integrate the CBT with the motivational interviewing approach to address the complex issues and the psychological problems she's experiencing. The motivation therapy will be used to encourage this patient to address the challenges to live a positive life. Integrative psychotherapy or psychotherapeutic interventions are useful when dealing with persons from different cultural backgrounds. Mindfulness based cognitive therapy, which is MBCT, is a psychological motivation used to help persons at risk for depressive relapse. The MBCT is combines with the CBT and mindfulness approach to assist patients with depression from various cultural backgrounds, according to McKinsey and Koski 2016. Motivational plays an important role in the Asian culture and can help the patient overcome her challenges. Asians like to be positive and be positive living their life without regrets. So Judy will use this mindfulness approach to explore her beliefs related to marriage and her existence. So now I'm going to call in Judy to come and join this therapy session. Hello, Judy, and welcome back to this session.
Hello.
I would like to request for your consent to audio and videotape this session. I would like you to tell me your name and acknowledge your consent to record this interview for my university assignment and permit my classmates and instructors to watch this video.
My name is Judy and I consent.
Okay, and thank you. Today I'll be applying three different therapies to each session based on the information you had provided to me earlier in our previous session.
Okay.
The first one will be cognitive behavioral therapy. Judy, what are some of the negative thoughts you have?
I am a failure. I blame myself for my failed marriage and I feel like dying.
Now, each time you have those such thoughts, think positively, Judy. Can
Okay.
you come up with anything positive about yourself or about your situation?
I am beautiful. I do not have to die. I did not fail my marriage and I am successful woman.
Judy, now every time you have negative thoughts and feel bad about yourself, always repeat that statement.
Okay, I will. I think I like this. I like saying this.
Very good. Motivational interviewing is my next approach. I will use this as an adjunct for treatments to increase commitment to the intervention that we displayed. Thus, I plan to use motivational interviewing as a secondary method to encourage you to face challenges associated with cognitive restructuring. Judy, I know that changing your thoughts can be challenging, but I encourage you to be positive. Judy, why do you experience daily weeping spells, restlessness, and anxiety fatigue?
I miss my husband. I never expected that he would leave me for another woman.
And I hear you, and I'm sorry that you're feeling this way, Judy. Now you have to choose a choice to make here and to handle these things differently. For example, when you feel like crying, think about your son, think about your career, think about your education.
I'm trying to be positive, but some days are not so good. I just keep thinking of what my husband did and got upset.
Judy, I hear you and I understand you. But let's stay positive and explore the possibility of having a better future. Do you have any family or friends you can call as well?
I do, but I don't really communicate with them.
Uh, I encourage you to reach out to your closest family member or friend. In future therapy sessions, we can go over different approaches of knowing how to reach out to those members. I can also help you at any time that you feel like giving up, okay?
Okay, thank you.
You're welcome. In this next session, I'm going to talk about mindfulness, okay? I will use mindfulness as the last approach to be applied to you. Judy, you'll be trained to stay still and focus on your inner being. Now breathe in and out slowly for the next 5 minutes. Can you do that for me? Judy, keep breathing in and out. Let the breath flow in and out of your body effortlessly and let your thoughts go. You can continually develop the habit for not letting negative thoughts take you over by countering them. Do you understand? What else are you feeling?
I feel okay somewhat.
Okay. And how else?
I just feel like I failed my marriage, school, and my family. I didn't fight hard enough.
Judy, when you're faced with negative thoughts, just relax, close your eyes, and breathe in and out 5 times. Tell yourself that these thoughts are not true. Can you say that for me?
These thoughts are not true.
And you do not have to believe in them. You will feel relieved knowing that those thoughts are not true, Judy. Judy, remember to follow the steps to improve your thought process in life. In case you experience an issue that is disturbing, always call my clinic or call a close family member or friend.
Okay, I think I can do this.
I look forward to meeting with you next week and thank you for your time and sharing with us.
Thank you.
Okay, Judy, thank you. You take care, okay?
Okay.
So Judy's going to leave the room right now. To conclude, I feel that the three approaches will be effective in helping Judy manage her anxiety and her depression. Motivation therapy and mindfulness are promising approaches that will encourage Judy to live a positive life. Formal mindfulness training will bring awareness to the body's sensations, while sitting meditation will improve on Judy's thoughts and feelings. Judy needs to stop living an isolated life and involve her family and her friends in order for this therapy to actually work. Thank you.